Good morning. Today is Tuesday, February 9th. This is a regular meeting of the Kings County Board of Supervisors. Due to issues arising from COVID-19, the board is using a teleconferencing format for today's meeting. We are participating via the World Wide Web. If you would like to make a public comment today, please make sure you identify by name. You're identified by name in the WebEx system. For those interested in commenting during unscheduled appearances, please use the raise your hand feature and wait to be recognized. Each speaker will be allowed up to 2 minutes for a public comment. Each vote will be a verbal or voice vote so that the members of the public can hear how each board member has voted. After we have a motion and a second regarding each item we are taking up today, we will be doing a roll call vote by district. Madam Clerk, would you please call the roll?
Joe Nix.
Here.
Richard Valley.
Here.
Doug Verboon.
Here.
Craig Peterson.
Here.
Richard Fagundes.
Here. Great, we've got 5 present. Okay, at this time, ask Sheriff Dave Robbins, please an introduction.
Hey, sir. Good morning, everyone. Please bow your heads with me as we say a quick prayer this morning to start the day. Dear Lord, please, bless us in everything that we do today, and bless this Board of Supervisors in the decisions that they make throughout this agenda this morning and beyond. A special blessing goes out to the Sacramento Sheriff's deputy who lost his life a couple of weeks ago in a tragedy. And, the men and women of law enforcement, the things they do day in and day out, bless public safety overall. And, a special blessing to our health department this year. This past year, they've, just poured their heart and soul into this pandemic. And, we can't thank them enough for everything that they've done. And with that said, in Jesus' name we pray. Amen.
Amen. Please join me in the flag salute. Ready? Salute. Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Craig, is your light on your microphone?
Yep.
Okay.
Okay, moving on to item 2, unscheduled appearances. Any person may directly address the board at this time on any item on the agenda or any other items of interest to the public that is within the subject matter jurisdiction. 4 2 minutes are allowed for each item. We have make public comment. Okay, we will move on to item 3, approval of the minutes, the February 2nd, 2021 regular meeting.
So move. Second, Mr. Chair.
Motion by Fagundes, second by Ness. Madam Clerk, please call roll.
Joe Nix.
Yes.
Richard Valley.
Aye.
Doug Verboon.
Yes.
Craig Peterson.
Aye.
Richard Fagundes.
Yes.
Good, 5 in favor. On to the consent calendar. The items that need to be removed for separate discussion. If not, we'll entertain a motion to accept the consent calendar.
There are no comment or questions or comment. Second.
Okay, we have a motion by Supervisor Fagundes, second by Supervisor Neves. Madam Clerk, please call the roll.
Joe Nix.
Yes.
Richard Valley.
Aye.
Doug Verboon.
Yes.
Craig Peterson.
Aye.
Richard Fagundes.
Yes.
Got 5 in favor of that. Okay, on to regular items. Community Development Agency and Craig Hudson.
Morning, Chairman. Fellow members of the board. Greg Gaska, Community Development Agency Director. Here to give you a quick update on the Planning Commission's actions. They did hold a special meeting on February 1st, 2021, and only had one item for consideration, and that was a vesting tentative parcel map, number 931. This, because it's a land division, did require that they convene as the Division 2 of the Kings County Advisory Agency. So they held the meeting under that hat, considered this land division, which is related to the Jackson Ranch specific plan. This was a proposal to divide the 424 0.87 acres into 55 parcels, ranging in size from 0.7 of an acre to 91 acres. And that would facilitate the division of the land for that specific plan to allow it to move forward. Planning Commission did hold the public hearing for that and received no testimony and moved forward to vote in favor, 4 in favor, and we had 1 absent. And that was the only item for their consideration during that meeting.
Thank you. That's it for the report. Okay, on to item 5B from Human Resources.
Chair, should we accept the report from the Planning Commission as presented?
Yeah, are we live? I mean, it sounds like he just left. It's got a little quiet there. All right, we will, is that a motion, Supervisor?
Yes, sir. I make a motion to approve the Planning Commission actions as presented.
Very good, thank you. Second. Okay, we have a motion and a second. Madam Clerk, please call the roll.
Joe Nevs.
Yes.
Richard Valley.
Aye.
Doug Verboon.
Yes.
Craig Peterson.
Aye.
Richard Fagundes.
Yes.
Got 5 in favor. Okay, back to item B and hearing.
I believe Anthony is actually going to present.
Okay,
Is something-
whoever, please step up. Number 10. All right, hearing nothing, we're gonna move on to 5C, Human Services Agency and Sonia Bouguet.
Good morning, Board Member Sonia Bouguet, Human Services Agency Director. The first item before you is a request to approve the advanced step hire for Raul Luna, Program Manager for the Human Services Agency at the range 233, Step 5. This is a Program Manager position that would help oversee our fiscal division. Over the past 2 years, we have gone through a number of recruitments and reorganizational changes and have had a really hard time hiring for this position. Ultimately, through different reorgs, we've landed with filling a program manager position, and only a single candidate, who is Raul, for this position actually had a requisite experience. This is an employee that worked for the county for a number of years and worked for our fiscal department, and in the last couple of years left for a management position. Bringing him back at this level would ensure he does not take a pay cut and would fill this really incredibly important need for us and bring the experience for a management position to oversee this position. Human Resources has reviewed the application and agrees that the individual meets the required qualifications and supports the advanced step hire. I'm available for any questions.
Very good, questions from the board?
If there are no questions, Mr. Chair, move as outlined.
We have a motion by Neb, second by Fagundes. Madam Clerk, please call the roll.
Joe Nevs.
Yes.
Richard Valley.
Aye.
Doug Verboon.
Yes.
Craig Peterson.
Aye.
Richard Fagundes.
Yes.
5 in favor, motion carries. And on to item 2.
Thank you. The item before you was presented on February 2nd and is being brought back for reconsideration at the request of Supervisor Fagundes. I appreciate an opportunity to answer questions and provide the spending status on the various projects related to our housing and sheltering. This particular item is specifically related to Project Room Key and Sheltering, and it is a request to accept funds from California Department of Social Services and to adjust appropriations so the project would have sufficient appropriations through the end of the year. The acceptance of funds does not change any of our operational agreements, so the project will continue operating as is. It simply provides us with an additional funding source to cover expenses. While we are conducting an effort currently to make this operation less costly, those efforts are slower than we've anticipated, and we do not have an alternatives to present to you yet. I'm hoping we will be back with that. Currently, the project room key operations are costing us $320,000 per month. It varies month by month depending on the number of people sheltered and food expenses, some of the perishable expenses. And the project through mid-January has been covered with 75% FEMA funds and then 25% match funds. We have utilized various funding sources to cover that match. Recently, there was a FEMA announcement that they would be covering 100% of project room key expenditures. However, we're still sorting through the timing of that and that all the expenditures that we have would be covered. The benefits of accepting these funds are really twofold. One is any FEMA non-reimbursed expenses would be covered because these are broader, there's broader eligibility for these funds. And if there's any remaining 25% match piece, it would be covered. But we do know that case management, rapid rehousing, and housing navigation costs aren't normally covered with FEMA, and that would be covered through these funds. These funds would work like our normal allocations for programs. We would incur expenditures, claim them, and then anything that's unspent would revert back to the state. That concludes my presentation, and I'm available for any questions.
Great, thank you. To the board for questions, comments, or motion.
I'll make a motion to approve as presented.
Next, the second, Mr. Chair.
Okay, we have a motion by Verboen, second by Neves. Madam Clerk, please call the roll.
Burnett,
Yes.
Richard Valley,
No.
Doug Verboen,
Yes.
Craig Peterson.
Aye.
Richard Fagundes.
Yes.
Okay, we have 4 in favor and 4 in favor and 1 against. That motion carried. All right, back to item B, Ms. Henry.
Good morning, Chair. We are having some audio difficulties this morning. I have Anthony Valdez who's going to present the item right now. So we went ahead and logged him through. He's going to do it right now. So I'm going to step aside.
Very good, thank you.
Good morning, Mr. Chairman, members of the board. My name is Anthony Valdez, I'm a personnel analyst with Human Resources. Can everyone hear me okay?
Yes, sir.
Okay. I'm here today regarding the new job specification and position allocation change in the Sheriff's Office. During the fiscal year 2019-2020 budget process, the Sheriff's Office allocated 1 full-time equivalency emergency dispatch supervisor position in the Radio Communications Division, budget unit 220600. This request was in response to the deletion of the emergency communications manager position in 2017, which substantially increased the workload to both the Radio Communications Division staff and the Sheriff's commander assigned to that division. Additionally, the deletion of the emergency communications manager made it very difficult to provide proper supervision. The position would handle the day-to-day operations of the Radio Communications Division, including prepare schedules, review requests for time off, approve time cards, deal with personnel issues, and plan and direct in-house training for dispatchers. The proposed job specification for the emergency dispatch supervisor was attached. With the addition of the emergency dispatch supervisor, it is necessary to delete the emergency dispatch training officer position, which is currently filled. If this action is approved as recommended, Human Resources will open a department-only promotional recruitment, which would result in a vacancy within the division. Should the current emergency dispatch training officer not successfully compete and be appointed to the new emergency dispatch supervisor position, a layoff would take place, which would include bumping rights to a lower classification within the series. These recommendations were provided to the union for an opportunity to meet and confer on the impacts of this change. The union has no objections to this recommendation. The cost for the new position for the remainder of the fiscal year would be offset by the deletion of the emergency dispatch training officer position, resulting in either a 5% savings, which is about $1,200, or an additional 5% cost, depending upon the outcome of the promotional recruitment. Therefore, HR recommends to approve the new job specification for emergency dispatch supervisor and set the salary range at 205.0, which is a range of $4,621 to $5,639 monthly, and to delete the full-time equivalency emergency dispatch training officer position in budget 220600. If you have any questions, I would be happy to address them.
Very good, thank you, Anthony. Questions, comments from the board?
I'll make the motion to approve as presented.
Very good, we have a motion by Verboen, second by Fagundes. Madam Clerk, please call roll.
Joe Nevs,
Yes.
Richard Valley.
Aye.
Doug Verboen,
Yes.
Craig Peterson,
Aye.
Richard Fagundes.
Yes.
5 in favor. Okay, on to item D, information
Thank
technology.
you.
John Devlin.
Hello, you hear me okay?
Yes.
You hear me all right? Okay. Bring up my item here. Hang on, I just lost my item.
Gonna call IT?
No, I'm in the office with one monitor. It's horrible. Okay, I found it. Here it is. Yeah. Alrighty, I've got it again. Okay, so what you have before you is a proposal to post the recorded meetings on the county YouTube channel. So the county can easily post the recorded meetings to YouTube for public consumption without any cost. And the recommendation is to approve posting the recorded Board of Supervisor meetings to the county's YouTube channel. There is no cost of posting the recorded meeting to our YouTube channel. As background, the county's been using WebEx for the board meetings since March 24th, 2020, in order to prevent COVID spread. However, too many active viewers online for the meeting, causing issues, and people could talk over the board or other background noises would cause meeting interruptions, which overwhelmed the bandwidth and caused issues with the board being able to conduct normal business. Staff researched several options, and one option was that staff received a quote from WebEx to add the option wherein there would be active participants and view-only participants. The cost would have been $4,200 annually, so a different path was chosen. Staff also has a mechanism in place for the public to move from the YouTube viewer-only platform by sending an email to bosquestions@co.kings.ca.us, and they'll receive an automatic response with current meeting WebEx information, so that they can change platforms if they wish to address them. Public may also send an email to bosquestions@co.kings.ca.us and have staff respond to them during the meeting. Or this may be used as a way to send their testimony to the board without having to speak and having their information become part of the permanent record. Board meeting recordings have never been posted on the internet, and due to the changes in the businesses conducted because of COVID-19, we have the opportunity to adapt the process to meet the needs of staff and the public in the way that we do business. Posting the meetings on YouTube will not cost the county any money. The videos are set up to not allow comments either during the live stream of the meeting nor after the meetings. This was set up due to not having staff to be able to monitor the platform during the meetings or after. Staff has all the meetings available on the administrative side of the YouTube channel from the point of service date of August 25th, 2020, and they can be uploaded to the channel if the board chooses to do so. I'm available for any questions.
Great, thank you, John. Questions from the board?
Mr. Chair.
Yes.
Mr. Devlin, is there a way to save the master copy of those Facebook Live meetings just to have a historical catalog? You know, I'm not sure government really covers that, how long to keep that record or not. And do you see the need of keeping a digital master copy that cannot be altered or changed in any way?
Well, the Supervisor Neves, through the chair, the official copy is the WebEx. The YouTube is the basically unofficial copy, but WebEx is still the primary means. The YouTube is just the side stream, and it's just much easier to publish, and there's no cost. So that's kind of why we chose that.
Yeah, no, I'm just thinking about using it as a backup copy to WebEx so that we have an additional copy that we can ensure that is not unaltered or that we have some control over as far as it's, because as you know, technology sometimes is difficult to use, and sometimes, you know, an additional backup would be extremely valuable, should you lose that WebEx connection.
Sure. Yeah. The YouTube's always available. To my knowledge, there's no limit on how much video you can put on there. So that would also be a backup to our WebEx if needed. And then there's also the audio recording that's from the chamber that is also an official record.
Yeah, and sometimes it fails.
So
Yeah, and you know, Facebook, they can pull anything off anytime they feel like it. I just wanted a more secure way to keep a master copy, and again, it is a repetitive, and other than the storage cost, and I don't know how much room those meetings, you know, would consume, and I don't know how long to keep them, but I think there may be some validity in keeping an unaltered copy of a copy, so that we have a repetitive backup system to not lose that data. But if you don't think it's necessary, you're the IT guy.
well, like I said, we've got the WebEx copy, and we have the YouTube copy, and not only are they set up to be not alterable, I mean, anybody could pull in the video and try to alter it. I mean, with digital information, I mean, look at this beautiful flag and logo behind me. But you know, you can alter anything you want with the digital age, but the videos as they are posted to YouTube, we have the control over those channels, so nobody on that can post anything. Only Kings County can post stuff to that channel. And the only thing we post are going to be these meetings. And those are unalterable, and they can't, I'm sure you've seen videos where you can chat online to, you know, say, oh, that was so funny or whatever. You're not allowed to chat even after they're recorded. So that way it should always be unaltered and uncommented on.
All right, thank you very much.
You're welcome.
Further questions from the board?
If there are no questions, Mr. Chair, I'll move as presented.
I'll move. Okay, we have a motion by Neves, second by Fagutis. Madam Clerk, please call the roll.
Joe Nevs,
Yes.
Richard Valley,
Aye.
Doug Verboon. He stepped off. Craig Peterson.
Aye.
Richard Fagundes.
Yes.
Verboen says aye. Sorry.
Okay,
Thank you.
saved by the bell, 5-0. All right, on to item E, administration. Carrier Martinez.
Good morning, board members. Terry Martinez. Today I will give the board a weekly update on the impacts of the COVID-19. This report will go over state and federal actions, county actions of the week, and upcoming challenges. I will then turn the presentation over to Mr. Ed Hill, who will give your board a local public health update. The last update was given to your board was on February 2nd, 2021. So on the state update, new vaccination guidelines were released. Department of Health Services released updated vaccine allocation guidelines this week, which include the following. Family members, caregivers of individuals with development disabilities are in phase 1 are healthcare workers who are directly exposed to the virus. Also included are people who are either researching, testing, and developing the vaccine, or people who manufacture protective gear, with the state citing that adverse public health impacts that delay in production would cause. Only educational and all child care workers fall into phase 1B, first tier, including all K-12 school staff, all university, junior college, and community college staff. all educational support services, technical and trade school staff, and any other workers involved in child and or student care, which the state specifically said includes bus drivers and monitors or crossing guards. The new document specifies that all restaurant staff can qualify for vaccine in phase 1B, including those not listed in previous essential workers definitions. Occupations that are not in phase 1A per the revised guidelines include veterinary support staff, people that manage healthcare plans, billing and health information, and people who support outdoor recreational facilities, which the state says does not translate to direct occupational risk. Veterinary staff can, however, qualify under phase 1B according to the new guidance. On the federal update, the White House announces plans to use the Defense Production Act. The White House COVID-19 Task Force recently announced that Biden administration will use the Defense Production Act to ramp up the manufacturing of vaccines, tests, and personal protective equipment as part of an effort to increase supplies and reduce long-term dependence on foreign suppliers. In addition, Defense Secretary Lloyd Austin has formally approved a request from FEMA to deploy more than 1,000 troops to support vaccination sites. The first active duty military personnel will arrive in California within the next week and is scheduled to begin operations on or around February 15th. The service members, and majority of whom will be medical personnel, are expected to be stationed at 5 FEMA mega sites, 2 of which are in Oakland and East Los Angeles. Looking ahead, the president has vowed to open 100 federally supported vaccination sites over the next month. This would be in addition to the existing 175 sites that are already operating throughout the country. And on the Kings County update, the County Emergency Operations Center is continuing to virtually meet now one time per week. The county has taken steps to reduce health risks to employees and the public by adjusting business practices and service delivery through many of its departments. And at this time, I would like to turn it over to Mr. Ed Hill, Public Health Director.
Morning, Mr. Chairman, members of the board, Ed Hill, Public Health. I would like to start my report, as I always do, by reminding everyone the simple steps we can take to protect ourselves and loved ones from communicable diseases such as COVID-19, and those are frequently wash your hands for 20 seconds or more. Don't touch your face with unwashed hands. Stay hydrated with water. A hydrated cell is a healthy cell. Stay home if you're sick, and then, of course, wear cloth face coverings to protect yourself and loved ones. Our current numbers for today are, we have collected 164,891 test samples. We have 546 results pending. We're currently monitoring 9,365 individuals. Our current total cases since the outbreak began is 14,127. Total deaths are unfortunately at 180 now. Total recovered is 6,511, bringing our active cases to 7,436. Our skilled nursing facilities in King County seem to have leveled off. They have 307 total cases since the outbreak began. They have 44 active cases, 228 recovered, and 35 deaths, unfortunately. State prisons have seemed to start to level off as well. They currently have a total of 7,569 cases since the outbreak began. That's Corcoran at 1,178, Avenel State Prison at 3,281, and SADF at 3,110. They've collected 110,681 samples. They currently have 289 results pending. Their active cases are at 1,929. Recovered is at 5,224, and unfortunately with 17 deaths. They have had no change since of yesterday in new cases, which is a good sign. We hope that that trend continues. We continue to watch hospital data closely as usual. We're seeing a small increase in ICU admissions locally and throughout the region. It does appear that the medical surge or regular admissions have leveled off, and even after the state changed the definition of what constitutes a COVID admission. If you remember at the last report, I indicated that change caused a spike from, I think it was 70 to 90 patients overnight, but they have leveled off. In fact, they only have 72 patients currently in the hospital. That includes those with the new definition, 12 in the intensive care unit. They currently have 0 capacity in their ICU, and they currently have no inmates hospitalized. The state did lift the hospital surge order on February 5th that allows hospitals to resume elective surgeries and other conventional standards of care. We are still currently maintaining a 60-day supply of PPE for all of our healthcare providers. That's gowns, gloves, and face masks. The hospital has received staff from the state, and they are still using that staff until that contract expires. As of yesterday, the Porterville alternate care site census was at 5 patients. Because of this, they are considering standing that site down and turning it into a warm status. The Central California Emergency Medical Services Agency reported yesterday that the Fresno alternate care site, this was a non-COVID patient alternate care site, has actually stood down and is now at a warm status as well. There are negotiations with staff to transition that staff to the antibody treatment center that is supposedly coming to Fresno, and I'll update when I get more information on that. Their assess and refer policy is still also not being used at this time as the EMS call volume has leveled off. The mobile testing program schedule is on our website for this week. We continue to hold regularly scheduled follow-up calls with the State Unified Support Team and work through any issues. Our current metric numbers this week, our new cases per 100,000 is at 42.1. That's a decrease from 53.6 last week. This does still meet the purple tier criteria, but we are starting to see a decline in new cases, which is a good sign. As I mentioned last week, we were back in the double digits. We did see a small spike over 100 cases for 2 days. As you remember, I indicated that we were anticipating that increase secondary to a 3-day weekend that we had just had 2 weeks prior. We did just have a 3-day weekend in Super Bowl this weekend, and we have another 3-day weekend coming up, so we do anticipate a small spike. But in between those spikes, we are seeing decreasing cases, which is a good sign. Our overall testing positivity is at 11%. That's down from 13.2% the week prior. Our testing positivity in the lowest quartile of the Healthy Places Index is at 15.7%, which is a decrease from 19% the previous week. Again, this means that all of our metrics meet the purple tier criteria, but again, we're moving in the right direction. Our tests per 100,000 is down at 548.6. This is the average per day. That was to be expected because of the holidays and the weather. We're also anticipating that testing may start to taper off as people begin to have testing fatigue set in. And then as we move forward, we'll have to weigh the advantages of testing and pushing that as the testing positivity I mentioned before is now back on the plate to help us move through the state's blueprint for a safer economy. Saturday, the state also announced a change in the places of worship guidelines secondary to a ruling by the Supreme Court. They are now able to operate at 25% of their capacity with other modifications. On a vaccine update, we, Public Health, continue to focus our efforts on the individuals that are 65 and older and distributing our vaccines equitably throughout the county. It looks like we are getting second doses of the Moderna commensurate with the initial shipments. This is good news, as if you remember, I expressed concerns that we started to hold second doses so that we didn't end up in the same predicament that we ended up with the Pfizer vaccines, where we ended up not having second doses, secondary to the state directing us to give 50% of our second dose allocations as first dose. It looks like Moderna is going to match it at this point in time, and I need to be clear here that at this point in time, it looks like they're going to match second dose for first dose, but that may change at any time. We have started regular discussions with Adventist Health on vaccine planning. We proposed that Adventist Health finish vaccinating all educators and law enforcement since they already started in those individual groups, and that we, Public Health, would finish vaccinating those over 65, and that we would come together and pool our resources so that we all can start vaccinating food and agriculture and child care service providers when that time comes, and once we've vaccinated those other populations. We will resume our conversations on that note with our ad representatives. We did pause this due to announcements by the state that they would be moving to a strictly age-based system, but that ended up not materializing and it won't take place until after Phase 1B, Tier 1 is completed. We still don't know how the third-party administrator will affect this, but we're going to continue planning and going down this path until we hear otherwise. We did execute the trade for some of our Moderna vaccine for Pfizer vaccine so that we could complete our second doses. As I mentioned before, we were short because of the state's directive. We did have some people decline because they had already received their second doses, some from somewhere else. There are also some who are isolating, so we will pick them up when they're done. And then there are also some that just declined outright their second dose, and we're trying to pin down reasons for their declination. Our vaccine allotment for this week of Moderna is 1,100, which is an increase, and we're hoping that this will be the trend that continues in the future. We still do not, and we don't anticipate receiving any additional Pfizer at this time. We also did receive an additional 500 doses from CDCR who did not use their entire allocations across the state, and they actually ended up distributing these unused doses to the locals. And I have to thank the sheriff, Mr. Dave Robinson, as he was in regular discussions with CDCR administration. This topic came up, and he expressed the need for additional local vaccines. The struggle we'll have here is we will have to hold back 250 for second doses, as this is not part of the state's allocation, so they will not be sending us second doses, so we'll have to split that. But it does give us an additional batch of vaccines to use moving forward, and it's much appreciated. The federal pharmacy program is expected to launch on February 11th for CVS and Rite Aid chains in California. There's been some stories about the vaccine being offered in CVS at Clovis, but we don't have any information about this process here in Kings. As I had mentioned in the past, we had been trying to coordinate and work with CVS over their program with the skilled nursing facilities and assisted living facilities, and we've not had any success. I believe Supervisor Valley will bring up a letter that I provided data for to CVS in an attempt to bring more vaccines to us later during this presentation or during his announcements. We are in the process of also deploying the state's MyTurn. This is the state's required vaccine management and appointment system throughout the state. This is going to be a challenge, and it begs a lot of questions that the state nor the vendor have been able to answer at this time. We will be releasing a press release in the very near future, which are going to cover the steps will be taken, such as reconciling our current wait list with our providers, what this means for people that are on the wait list, what this means for those who have completed the interest survey. We do know that the system will not allow for merging of our current wait list, so we will likely establish a call center, and our staff will call everybody on the waiting list and move them over to the new platform for them, so that it's one less thing they have to worry about, but it will cause confusion in the system. Again, we will be issuing a press release on those details today, and then a possible launch date, and then of course we'll send out additional press releases and media on the date that we actually shift over to MyTurn. On that note, the state's data system tracking the vaccine distribution is not in good shape. There are a lot of data issues. The state did submit a document to all the locals, which included vaccines delivered, vaccines administered, and vaccines on hand, and none of the numbers were correct. For example, the document showed Kings County had only administered 25% or 1,160 of the vaccines received, which is not accurate. In fact, this is, if you go to the state's website on vaccines, it shows that Kings County Kings County population vaccinated this time is over 7,000. This is a result of the multiple data systems that are in play here. There's a federal data system, a state data systems, and there are two in each one of those locations. They use different data systems for different movements, such as the vaccines that are allocated to us, the vaccines we allocate to others, and the vaccines that we distribute or administer ourselves. They're working hard to clean that up, but it is very confusing. And the biggest concern is this is how the state is going to determine allocations moving forward. So at least we know that they're dedicated to at least straightening out the data before they start making those decisions on those allocations in the near future. Finally, 2 weeks ago, the governor announced the new third-party administrator process, which is supposed to be rolled out in the very near future. On a call with last Friday with Yolanda Richardson, Secretary of the Government Operations Agency, she stated that they expected the contract to be executed as early as this week. I was also on a call yesterday with the state, and they anticipate rolling this out in some of the counties very soon, maybe even as soon as by the end of this week. There are multiple issues with this program. There's been very little support, if none, at the local level. There are so many unknowns, and it's feeling like it's being extremely rushed. A lot of the unknowns are, will the new administrator be the one determining the vaccine allocations? How would they establish a process with current providers who don't already ensure that the equitable distribution of the vaccine occurs? They promise complete data transparency, but we know that there's data issues not only locally, but at the state and at the federal level. They'll likely be introducing additional data systems, which will also come with many other issues. And they may be creating a new process and provider networks when the locals have already done the work so far to scale up these operations. So I'm going to go ahead and stop there and conclude my report, and I'm happy to answer any questions.
Very good, thank you. Questions for the board? Supervisor. Go ahead, Supervisor.
Thank you, Mr. Chairman. Sorry, I didn't hear you. First of all, I want to say thank Sheriff Robinson. That was outstanding news to hear about his efforts there, and 500 vaccines is 500 vaccines. And that's much appreciated. Good work, Sheriff. Mr. Chairman, I just want to point out that early on last year, the board, we got information on as it relates to who we were having trouble testing. We identified challenges to getting groups to come get their COVID testing. At one point, I believe Hispanics represented 78% of all infections, COVID infections in the county of Kings. If you look at the dashboard on our website now, we got that down on any day to 55%. And even though that's high, that represents a lot of work, a lot of effort on a lot of people's parts. I know at one point, the death rate amongst Latinos as it relates to COVID deaths in the county mirrored that infection rate. I'd like to get some information on what that percentage is today. But moving forward, Mr. Chair, when it comes to the issue of vaccines, we knew that a lot of what we saw when it came to COVID testing, we were going to experience that is in the form of trying to get the vaccines out. We knew from long before we ever got our first doses in the county that this was not going to be an easy mission. So now we're dealing with issues of vaccine hesitancy. I'm happy to hear every week from Mr. Ed Hill that we're going a long ways and getting past that. In fact, we have a long waiting list of people who are saying, I want the vaccine when it's my turn. People probably reach out to all of us, Mr. Chair, on a daily basis, asking if we know when the county is going to be administering more vaccines. And so all that said, Mr. Chair, is coming to this fact that when you read the big media announcements of CVS and the fact that they were coming to California and they were going to supply their CVS pharmacies with thousands of vaccines, to find out that Kings County was not on that list was disappointing, to say the least. Also, as Mr. Hills pointed out a couple of times on our Monday morning calls, that he's having trouble with the line of communication with CVS. So he's doing his job and trying to reach out to, to present the case that the location in Kings County would meet a lot of what CVS is putting out there to the public on the image that they want to be seen as, per the quote in the letter. By the way, I want to thank Ed, County Council, and the clerk for helping me to get this letter before you today. We thought it'd be best to put on county letterhead and present it in a way that the board could just see the whole thing here. Mr. Chairman, so CVS is putting out in the quote in the letter that, that their goal is to have a fair and equitable distribution of the vaccine. And I think that with the goal of this letter here to the CEO of CVS, that, Kings County is asking just for that. And we have an argument to be made here that they're highlighting the Clovis CVS pharmacy. And with the information working with Ed Hill, you'll see there's a good paragraph here in this letter where it outlines that if CVS is sending these thousands of vaccines to Clovis based on the data Well, Kings County, our data is far worse. Clovis is one of the wealthiest communities in the state of California. Our communities in the county of Kings, some of them represent the poorest. We have a large farm worker population. A lot of people who have been involved in these outbreaks have been the most vulnerable in this pandemic from day one. This is an opportunity to help them. This is an opportunity to help the folks in Lemoore, the folks in Hanford. The data in Hanford shows that our case rates, our incident rates are far worse than Clovis. So, Mr. Chairman, I believe this letter gives the Board of Supervisors an opportunity, if passed, to get the attention of CVS directly to the CEO, to present our case here and to offer to help with their mission of a fair and equitable distribution of this vaccine amongst the communities in the state of California. Mr. Chair, I'd like to see if Ed would have anything to add as far as his efforts on this letter and explain some of this data in comparison to Clovis. But I did respectfully want to ask the board to please consider this letter. I think we all did a good job coming together in the letters that was sent to the president, to the governor. And I think this is yet another opportunity for the Board of Supervisors to show the residents of the County of Kings that we are doing everything possible to get vaccines to our residents in the county. There's nothing more important right now. People are dying. This pandemic is real. That does not even need to be said anymore. And we have a lot of good people out here working without days off. Our health department employees, our frontline, our public safety, helping to ensure the health and safety of the residents of Kings County. This is a way for us to do our part here. I'll close up before Ed, Mr. Chair, and just saying that I worked with closely with Supervisor Luis Alejo out of Monterey County. Mr. Chair, CVS passed up on some of the most rural and poorest communities in the county of Monterey. Their Board of Supervisors last week passed this letter. They sent it to the CEO, and within 24 to 48 hours, CVS opened up 2 more locations to bring vaccines into Monterey County. So this is a good use of the board's time. Supervisor Leo was kind enough to let me borrow the language from the letter. And so I worked yesterday just retyping it and tailoring it to the county, and then working with council to make sure this is something that would clear her department, her eyes, to get before the board, and then whatever Mr. Hill would have. So thank you for hearing me out, members of the board, and thank you, Mr. Chairman, for the time.
Okay, you bet. Thank you. So Director Hill, you have any additional information or want to share?
Chairman Peterson.
Yes, sir.
Sorry, I wasn't sure if you were opening it back up for me or not. I'm having audio difficulties here.
Yeah, no problem. No, I think there was some directives from Supervisor Valley with some information that he wanted to ask you or might want you to share. But if you have nothing else, then we can bring back this letter to the board for motion to move it on.
Yeah, thank you, Mr. Chairman. To provide a little bit more insight on that data, it is correct that our new cases per 100,000 and our testing positivity are higher than other jurisdictions around us in the Central Valley. In fact, our new cases per 100,000 remains higher than other counties, even when we are receiving additional credit for testing more than the state median. Some of the surrounding counties are actually testing less than the state median, and they're actually being penalized, meaning they are increasing. The state is increasing their new cases per 100,000 score because they are not testing enough, and they are still considerably lower than our new cases per 100,000, which shows that our cases are continuing to happen at a higher rate, our new cases in the county, as well as our testing positivity. So again, the idea is that we need to continue to push, which your board has done and the CAO has done, to get additional vaccines to our county. I agree. and anything that we can do to help that is much appreciated.
Great, thank you. So I just quickly looked, they have, what, CVS has almost 10,000 stores in the US. I just wonder if it sounds like someone had a direct line to the CEO, and I hope that these letters make it that quickly. I'm just curious if there's a regional manager or something that we could probably shoot this to as well, to ensure that it doesn't get off on some goofy side of the desk. But from what I understand, we don't need to have a motion, but if it's the consensus of the board to go ahead and send this letter. So do I have consensus from the board, Supervisor Downs? Position.
Mr. Chair, thank you for the opportunity. I think the only thing I would like to see in that letter is that the Kings County Health Department has more capacity than supply of dosages, and you never know what kind of information the CVS management is receiving, because it's such a disjointed communication plan between federal, state, and local. And so I think I would kind of like to, either in that first paragraph or somewhere along the line, just inform them that the Kings County Health Department and agencies in the county administering the vaccine has more capacity than we have supply. And I didn't see that listed in the correspondence anywhere. And I think that's a very important point to make, because again, private enterprise and agencies administering the vaccine, I'm sure somebody somewhere along the line offered it to private enterprise, the pharmacy industry. And you just don't know what information they had to get to that point. I think Ed can correct me, but I think the pharmacies get even the seasonal flu shots before our health department get it. And this COVID is a little bit different. I'm still not real happy with the ways the supply distribution is taking place, but I would like to see a little bit more information in the letter to CVS and to other local pharmacies, because I know other pharmacies are also advertising the same service to be able to administer the vaccine. But I didn't see anything in there that we at the local level do have the capacity, we just lack the supply.
Okay.
Mr. Chairman, if I could offer, I think that excellent point would go very well in the closing paragraph. That's an important line to have, as mentioned by Supervisor Neves. Maybe we can modify the letter to include a sentence in that last paragraph to meet that point. And again, Mr. Chair, for the public who doesn't have the letter, the goal of the letter is asking CVS to consider sending vaccines to the Hanford CVS location. That pharmacy has the ability to roll out this vaccine, and we believe that would be fair. And the city of Hanford would be an excellent location for folks from all over the county of Kings to come and another place to have an opportunity at the vaccine. That's the goal of the letter.
Very good. And I understand that this letter is available from the clerk's office to anyone out in the public. But having said that, sounds like the only person I haven't heard from is Supervisor Boone from a consensus standpoint. You good with this, Supervisor?
Thank you, Mr. Chair. I appreciate that. So I kind of agree with Supervisor Neves with the fact that, how come we have private entity having a rollout of the vaccine where we're the ones that get complained to all the time with this vaccine. We're not doing enough. And then all of a sudden now we can't get enough and they're going to CVS. I think we should support the CVS and get them to have the rollout in Kings County. But at the same time, I'm thinking, okay, how come we don't get any vaccines? And now the private side's getting it. I guess it doesn't matter. We just got to get the vaccines rolled out sooner the better. So If a letter is going to help to get the attention of Kings County to CPS to help them roll it out here, that'd be great. Anything we can do to get recognized, I appreciate it. So I'm okay with the letter.
Okay, it sounds like we do have consensus and maybe a few adaptations to the letter, but in general, board has consensus on this issue. Further information to come forward. I do have one question, Ed, Director Hill, with respect to the data on vaccinations, are we anywhere close? It sounds like you have some fairly good, solid information about actual vaccines administered in Kings County. I mean, is there a sharing process that's taking place, and do we have a good feel where we're at?
Thank you, Chairman Peterson. We do have a good understanding of the vaccines that we've received and that we've distributed to our providers and that they have provided within the county. I'm not sure if that answers your question. If the question is are we getting the vaccines out as soon as we get them? We are. It does take a day or two once we identify that we are getting the vaccines. Then there's also, we have to wait for the vaccine to be delivered because that can vary as well. They can say we're allocated 1,100, but until we have 1,100 in our hand, we don't want to promise that we have 1,100 because that does vary from time to time. And then we immediately schedule clinics. As for instance, we didn't have any clinics scheduled this week until we were assured that we had the vaccine, and we will be scheduling and standing up clinics this week to get the vaccine out, as well as distributing it through our providers and the folks that are helping us. Before I verify that answers your question, to Supervisor Nev's point and to assist with the letter, that information on our capabilities and capacity within the county is in the previous letter that the board wrote, so that information already exists. Chairman Peterson, did that address your question?
Yeah, I just, I know it's difficult to get, the private providers that are providing vaccine to share, but as we move forward and try to get our economy back open, it's going to be important to know the percentage of residents in our community that have had the vaccine, and obviously the mess at the state with their databases continues. But just wondering if anybody's been a little more open about those outside of the county that are administering vaccines. It's quite, so he may be having further challenges with his assistant. Okay, we did have consensus on the letter, and Kyria.
Just a moment, we're having an issue. We have, Ed cannot hear the audio, so.
Okay.
It's just his personal. Just give us a moment for us to troubleshoot that.
Okay. We're gonna take a short pause here and try our systems up to.
Just make sure that no one else is not able to hear. Supervisor Valley, are you able to hear us clearly?
What was that, Madam Clerk?
Are you able to hear us clearly? We've had some concerns that maybe the audio is not clear today.
I can hear you fine. Thank you, Madam Clerk.
Thank you. Oh, it's something on Ed's side.
Okay. All right. Any further information on that? Okay. At this time, then, we will move on to item 6, which is a study session from the administration. Who's handling that?
Diane.
Diane, I think you might be on mute. Can't hear you.
Can you hear me now?
Yes, ma'am.
Okay, thank you. Good morning, Mr. Chairman and members of the board. As you're aware, The county is required to redraw district boundaries every 10 years following the census. Some members of the board may be familiar with the process from prior years. However, there are numerous changes affecting the process for 2021. The purpose of this study session is to highlight some of those changes, provide an overview of the process, and to suggest things that the board can do now to begin. Apologize, let me get to a different screen. The board's obligation to adjust boundaries is found in Elections Code 21500. Following each federal decennial census and using that census as a basis, the board shall adjust the boundaries of any or all of the supervisorial districts of the county so that the supervisorial districts shall be substantially equal in population as required by the United States Constitution. There is a hierarchy of considerations that must be complied with. First and foremost is compliance with federal law. Federal law sets broad guidelines and establishes the outer limits for redistricting. The primary federal, yes?
Diane, you are not sharing your screen. Would you please share your screen?
Oh, yes.
Thank you.
Is that better?
Yes.
Yep, got it.
Okay. And am I still sharing my screen? Okay. So there is a hierarchy of considerations that must be complied with. First and foremost is compliance with federal law. Federal law sets broad guidelines and establishes the outer limit for redistricting. The primary federal law considerations include population equality, the Voting Rights Act, and equal protection. State law establishes more specific requirements. It's under state law with the recently enacted AB 829 and AP 1276 that we have seen most of the changes. Let's first discuss population equality. It's the overriding consideration, the overriding criterion for drawing the line. Population equality is both a federal and a state requirement. Under the recent changes to California law, total population and not just vote eligible population must be used. And incarcerated persons are not included unless their last known address can be traced back to the county. Once received, the state will adjust the federal census data to reflect the new law concerning incarcerated individuals and will provide that data for the county to use as it draws district lines. There are two relevant provisions in the Voting Rights Act, Section 2 and Section 5. Section 2 prohibits district lines that dilute racial and language minority voting strength, either through packing that strength into a single district or dividing, also known as cracking, that strength into multiple districts, either way, causing it to lose power. Pursuant to Section 2, if data collected shows a minority group can form a majority in a single-member district, it is possible that the county will need to create a minority opportunity district as part of its redistricting plan. Section 5 was enacted to prevent discrimination in the electoral process. It required certain jurisdictions to obtain approval from the federal government when changing district boundaries. Kings County has historically been a Section 5 county. However, Section 5 was invalidated in 2013 when the coverage formula was held unconstitutional. As a result, Kings County no longer needs to receive pre-approval prior to adopting its new district boundaries. The third federal consideration is equal protection. There is a tension in redistricting between the Voting Rights Act and the Equal Protection Clause. The Voting Rights Act says you must take race into account, but the Equal Protection Clause, as interpreted by the Supreme Court, says that it cannot be the predominant criterion. We'll have more understanding about how this tension will affect Kings County as the redistricting process unfolds. Now we'll move to a discussion of state law. AB 849 and 1276 significantly changed the criteria, timing, and procedures for redistricting. The changes affect all cities and counties. They revise and standardize redistricting throughout the state, eliminate discretionary criteria and rules, establish mandatory criteria ranked according to priority, and prohibit partisan gerrymandering. Historically, the county was able to balance factors related to redistricting according to its discretion. Under the new law, the county is required to establish boundaries based on legislatively mandated prioritized criteria. In the order of priority, and to the extent practicable, the criteria that must be considered are continuity, geographic integrity of neighborhoods, communities of interest, preservation of cities and census-designated places, easily identifiable natural and artificial boundaries, and finally, compactness. While many of these criteria are readily understandable, communities of interest has a statutory definition worth mentioning. A community of interest is defined as a population that shares a common social or economic interest that should be included within a single district for purposes of its effective and fair representation. This is a vague definition that can include almost anything, such as lifestyle, economy, demography, geography, political subdivisions, place-based issues. However, it does not include relationships with political parties, incumbents, or political candidates. Identifying communities of interest will be a challenge, and it may not be possible to keep them all intact, but to the extent it is possible, the county is required to do so. In addition to the substantive requirements I've already mentioned, the new law also imposes substantial new procedural requirements. They include expanded use of public hearings, a fixed timeline for adoption, public outreach, and record keeping. Before I go into each of these in detail, allow me to discuss delegation of authority to draw the district lines. Under prior law, the Board of Supervisors was required to draw the lines, and there was no express option to delegate that authority. Under the new law, specifically Elections Code 23001, the board may retain the responsibility to draw the lines or delegate the responsibility in whole or in part by establishing one of three types of commissions: an advisory, hybrid, or independent commission. If the board chooses to form a commission, the role of the commission and level of discretion the board retains will depend on the type of commission it chooses to form. An advisory commission recommends placement of boundaries, but the Board of Supervisors retains complete discretion to accept, modify, or reject the recommendation. A hybrid commission recommends two or more maps, and the Board of Supervisors is required to select one without modification. And finally, an independent commission has full authority to adopt the boundaries, independent of any further action by the Board of Supervisors. As indicated here, the requirements for who can serve as commissioners and how the appointments must be made will also vary according to the type of commission formed. Although establishing a commission is now statutorily approved, it's not mandatory. The determination of whether to establish a commission is a preliminary decision that will need to be made by the board. It would be prudent for the board to consider the issue and make a decision soon to ensure there is sufficient time to complete the redistricting process before the adoption deadline. The adoption deadline is one of the most important pieces of information to take away from this presentation today. The county must adopt its new district boundaries before December 15th, 2021. This is 174 days before the county's June 7th, 2022 primary election. If the county fails to meet the December 15th deadline for any reason, it will lose its authority to act, and the authority to redistrict will transfer to the court. County Council recommends that the board adopt district boundaries on or before November 15th, 2021, to allow the adopting ordinance to become effective by the December 15th, 2021 date. While the adoption deadline may currently seem far away, it's not too early to get started. Due to the complexities of the law and the extensiveness of the new procedures redistricting will require, it will take significant planning and time. For instance, the county must hold at least 4 public hearings prior to adoption of the new boundaries, at least 1 before the draft maps are drawn, at least 2 after the maps are drawn, and at least 1 outside of regular working hours. In addition, the public outreach requirements are extensive and include publication of the draft map at least 7 days before adoption, media outreach to community groups, good government groups, civil rights groups, and other civic engagement groups. It will require live translation if requested at public hearings, public notices on the internet, publication of relevant demographic data, and receipt of maps or testimony from the public in writing or electronically. Record keeping will also require significant planning and effort. Under the new law, all public comments must be recorded and publicly available. A web page must be established and maintained for 10 years. The content of the web page must include an explanation of the redistricting process, procedures for testifying or submitting written testimony, a calendar of all hearings and workshops, the notice and agenda for each hearing and workshop, a recording or written summary of each hearing and workshop, and all draft maps and the final adopted map. Finally, it's important that the process is performed carefully and thoughtfully. The county not only needs to create legally defensible boundaries, but it also needs to do its best to ensure that the boundaries will function as intended. Since under the new law, the county lacks the ability to reopen the districting process mid-decade, except in limited circumstances. With that said, I've identified a list of things the county can do now. The county can establish a commission if desired, hire consultants to help with the process if desired, identify community partners for community outreach, identify communities of interest, evaluate the anticipated scope of redistricting, plan the record-keeping system, and plan a timeline. It's uncertain when the county will actually receive the census data. Based on reports, the Census Bureau will not have the redistricting data to the state until after July 31st, 2021. Once the state receives the data, they'll need a couple of weeks to adjust it according to the new rules concerning incarcerated populations. The county is not likely to receive actual numbers to work with until August. However, the deadline for adopting boundaries is not expected to change. This will put the county in a time crunch and make it even more important to start the process early so that when the data does arrive, there is no unnecessary delay. I've provided a sample timeline which recommends at least 60 to 90 days to accomplish all of the hearing, publication, and mapping requirements. Of course, there will be a front-loaded process where we plan the redistricting and where we identify our community partners and all of those other issues that will become relevant. Today, while today is a study session only, I recommend that the matter be brought back for board action concerning the following issues: whether to form a commission, whether to hire a redistricting consultant to assist with the process, and if keeping it in-house, what county departments will be responsible for public outreach, record keeping, GIS mapping, demographic analysis, and recommending boundaries. With that, that ends my presentation, and I open the matter up for questions.
Thank you, Diane. Questions from the board, comments? Yes, I have a question, and I wasn't here 10 years ago. How did we accomplish this last time? Was there a commission or just done by the board of suits?
Mr. Chair, I think there was a contractor or consultant that took all of the information in. I think just about all of the other mapping, GIS, a lot of the other stuff is housed right now in community development. But I think there was a consultant. And with this new outline of process, there's probably going to have to be some kind of a outreach committee or outreach, because I'm not sure that that part of it is, well enough defined. As was pointed out, the timeline is going to be very, very short. Because if the information is not going to be available till July, everybody's blaming COVID on everything anyway. There's just barely a 90-day window now. And so I think a consultant would be the best way to go now. And with COVID guidelines, probably some kind of guidance from some kind of a, I'm not sure I want to say formal commission, but there will be some kind of a committee. And again, I think it's going to be very important because of the things that have changed from the previous redistricting. And we're not the only ones in this predicament. Cities are going to have to redistrict. Many of the school districts have had to go to district representation. So there's going to be a high demand for those kind of services. So I think it, as outlined, it makes a lot of sense to try to get a consultant on as soon as we can, but there's still no guarantee that we're going to rise to the top and be important, because everybody's going to have crunched these timelines. And so this is just a study session right now, but I think I would like to see the consultant area with that has some experience in a committee formation and not try to overburden the commission in coming up to speed on all of the new laws and regulations and guidelines needed, especially in a COVID environment.
Great. I know Greg Gasket's on the line and kind of was the primary in the last census to district lines. And I don't know, Greg, do you have any comments on that?
Hi, Chairman. Yeah, I am having a little bit difficulty hearing all of you in there, but I'm pretty sure you asked me to give some comments. County Counsel with Diane Freeman actually has been in talks with me about this whole new process, and I gave her and also our CAO a little bit of history on the previous round when we did this back in 2011. And so what Supervisor Neves mentioned is exactly what had happened. We had County Counsel at that time, Pete Mook, that really was the lead, hired his own consultant for the legal aspects, and we prepared maps using the GIS software to come up with alternatives that could demonstrate the population balances between the districts and the ethnicity and race balances as well. But that really was the limit of our function, was generating those maps. There really was limited flexibility in making adjustments without making big changes across all the board district boundaries, just simply due to the fact that there's a lot of territories that don't have a lot of population, and places like the Naval Air Base do. So when you make a small shift in one area, it changes those boundaries significantly. So I've let myself to be a support to Diane Freeman, to our CAO, in working through this and trying to help evaluate it. So I'm here as a resource, but it was primarily driven by County Counsel the last go around.
Mr. Chairman?
Yep, I got you. Go ahead.
Thank you, Mr. Chairman. Mr. Chairman, I'm also one of the board members who was around in 2011. To answer your question, there wasn't a commission. There was a push for a Citizens Advisory Commission 10 years ago. I pushed for that from the dais. Unfortunately, at that time, there wasn't support among the board for that. But 10 years later, Mr. Chair, I'm happy to see just a lot of the built-in issues that that we were talking about 10 years ago are now mandatory. And so this time around, I tend to agree with my colleague Supervisor Neves on finding a specialized consultant who's an expert on the issues of redistricting to assist County Counsel's office on this issue. This is a large undertaking. That goes without saying, especially with COVID now. I'm happy that, at this point, one of the things that COVID did is, in my opinion, make us more transparent, just from the simple fact that here we are through technology, broadcasting, people from all over the county can get on. This information will now, thanks to the board's decision, be on YouTube videos where someone could come home from work, watch the agenda item on this conversation, stay informed. I think that helps us a lot with the issues and challenges that we faced 10 years ago. And so I would be open to that, Mr. Chair, and interested in finding out if that's something that goes to RFP based on, the legalities of whether it's sole source or RFP. Is there anyone who specializes on this in Kings County? The question will probably be, is it fair to look for someone outside the county as well? Those types of things I'd be interested in hearing from county council on. But that being said, Mr. Chair, this is obviously very important. I would assume these same rules apply to the legislature, who has to undergo our Senate districts, our congressional and assembly districts are going to go through this process as well. And so, this is a very important time. And unfortunately, just like the census, it looks like they're going to be doing it with the challenges of COVID. And so that's not going to make this any easier with a task that's difficult and critical as well. But lastly, Mr. Chair, coming out of this 10 years ago is the reason why District 2 picked up Home Garden, because you go through this process and you realize, I think at that point my district was, anywhere from 2,500 to 3,000 folks less than some of the other districts. And to make it fair, there was a lot of options, and that's why District 2 grew to include the community of Home Garden. Thank you, Mr. Chair.
Thank you. Further comments from the board? This question back to administration and county council coordination wise. What are we looking at timelines? Has there been any additional kind of timelines laid out yet, or just react to the directions that?
Yeah, we're anticipating bringing this item back on the 23rd for board action item.
Mr. Chair, Lee Burdick, County Council, good morning. Before we bring it back on the 23rd, we will do some investigation to answer Supervisor Valley's questions about available consultants. Obviously, whether it can be sole sourced or mandatory RFP, which would need to go on an emergency basis or a very rapid pace, we will have better answers for that. And then at that time, the board can vote on its interest in whether to hire a consultant. It looks like they'll want that, but we'll bring it back for a vote, as well as whether you want to establish a committee or a commission and what the makeup of that ought to be. We'll work with admin to try to answer some of these questions before we seek board action.
Very good, thank you. Okay, we've covered it on this item, so thank you all for your presentations today. We'll move into item 7, which is board member comments. Supervisor Cruz. Okay. Thank you, Supervisor Ness. Supervisor Rowley.
Mr. Chair, the only thing I have is thanks again for everyone working together on the letter to CVS. And with time being critical, I would ask that, if possible, if that letter could be signed by Chairman Peterson today and sent out. And let's see how quickly, if any, we can make a difference with that. Thank you, Mr. Chairman. Oh, and if I get a copy of the letter after you sign, Mr. Chair, much appreciated. Thank you.
Thank you. Very good. Supervisor Boone.
I'm good. I've just had an interesting couple weeks, and thank you guys for being patient with me. And hopefully next Tuesday we'll be back on here and be back in the chambers to move forward. We had a couple meetings last week with Amtrak, and got another meeting coming up with Burris Park Foundation on Thursday at 9 o'clock in my office. If anybody wants to join me on that one, and that's all I have. Thank you.
Very good, thank you. And I have anything as well, so we'll move on to correspondence. Here.
So in board correspondence, we received 2 letters from the Department of Fish and Game. One is a notice of proposed regulatory action relating to Central Valley Sport Fishing Regulation. And another notice is of proposed regulatory action relating to the Klamath River Basin Sport Fishing Regulation. And we also received correspondence from Jackson Ranch, a signed resolution, and Jackson Ranch Pacific Plan. We do not have any upcoming meetings or events, and I'd like to note that next week's board supervisor meeting is canceled due to the holiday and will resume at the next board meeting on February 23rd. For upcoming agenda items, on the 23rd, administration will be bringing the COVID-19 update, a public forum regarding the Truth Act, a study session on the 2021 legislative platform. On February 23rd, also CDA is going to bring a public hearing to consider a 5-year review report of Kings County Integrated Waste Management Plan. HSA will also bring an amended agreement to the Champions Recovery Alternative Program, and also the Medi-Cal Health Enrollment Navigators Project. On February 23rd, IT and HSA will bring an item for proposed purchase of an enhanced email system. And that is it.
Thank you. Okay, we've moved through our agenda today. Thank you all for all of that. Any other further information coming from the board? Anyone? Seeing none, we have no closed session today. At 11 o'clock, we have our California Public Finance Authority regular meeting. And with that, meeting adjourned.
Same link for the 11 a.m.
Yes. Yes, Supervisor Valley.
Thank you.
All right, good morning. This is the scheduled date, February 9th, 2021, for the California Public Finance Authority regular meeting. Madam Clerk, please call the roll.
Joe Nevs.
Here.
Richard Valley.
Here.
Doug Verboon.
Here.
Craig Peterson.
We have 5 present. All right, on to item 2, approval of the minutes from February 2nd, 2021.
Nevs moves, Mr. Chair.
Okay, we have a motion by Nev, second by Fagundes. Madam Clerk, please call the roll.
Joe Nevs.
Yes.
Richard Valley.
Aye.
Doug Verboon.
Yes.
Craig Peterson.
Aye.
Richard Fagundes.
Yes. Got 5 in favor, thank you. Okay, on to item 3, new business. Item A, consider approving resolution 21-048 for Bidwell Place LP, Bidwell Place Apartments, City of Folsom, County of Sacramento, up to $20 million in reserve bonds. And Caitlin.
Yes, good morning. Thank you.
Good morning.
So this is our first housing project we're bringing to you this year. So this is for Place LP. They're requesting CalPFA issue a revenue note to assist in the acquisition and construction of the Bidwell Place apartments in Folsom. Bond amount will not exceed $20 million, and it's a 75-unit affordable housing project in Folsom for families. They do expect to close in March and start construction right away with completion in September of 2022. And then a number of public benefits on this project. 100% of the units will be affordable at 50 and 60% of the area median income level, and will remain so for 55 years. They will offer after-school programs and educational classes to residents. And it will also be a green community and have non-smoking buildings as well. And I'm happy to answer questions on Bidwell Place if you have any.
Very good, thank you. Questions of the board?
I'll make a motion to approve as presented.
Second. Good. We have a motion by Verboon, second by Fagundes. Madam Clerk, please call the roll.
Joe Nevs.
Yes.
Richard Valley.
Aye.
Doug Verboon.
Yes.
Craig Peterson.
Aye.
Richard Fagundes.
Yes. Okay, we have 5 in favor. On to item B, consider approving resolution 21-05A for First and Kern Affordable Apartments LP. And Kern Apartments, City of Gilroy, County of Santa Clara, up to $40 million in revenue bond. Okay.
Yes, this is for another new construction project of affordable. It's the First and Kern Apartments project located in Gilroy. And they have requested CalPFA to issue up to $40 million to finance the construction of that project. This will provide 120 affordable units to families in Gilroy. Again, they also do start construction and finish construction in late 2022. Like the last project, 100% of the units are affordable at 50 and 60% of the area median income. They will also offer programs to residents and will focus on energy efficiency in the construction of the project. And I'm happy to answer questions on First and Kern Apartments if you have any.
Making a motion to approve as presented.
Second.
Okay, we have a motion by Verboon, second by Neff. Madam Clerk, please call the roll.
Joe Nevs.
Yes.
Richard Valley.
Aye.
Doug Verboon.
Yes.
Craig Peterson.
Aye.
Richard Fagundes.
Yes. Okay, we have 5 in favor. Thank you, Caitlin. On to item 4, public comment. Any person may directly address the board at this time on any item on the agenda or other items of interest to the public that is within the subject matter jurisdiction of the board. 5 minutes are allowed for each item.
I have no one with their hands up or no written.
Very good. Thank you. We'll move on to staff updates. Caitlin, Scott, do you have any updates for us?
No updates from.
Okay, thank you.
Thank you.
Righty, we'll move on to item 6, which is adjourned. Thank you all for attending. Meeting is adjourned.
All right, thank you so much.
Thank you, take care.
Have a good day.
That's it.